Is sex allowed within 24 hours after delivery? This man almost killed his wife. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Tritaton, the Lupus Day.
Last month, during our antenatal care, our routine antenatal care, there's this particular couple that came in. The pregnant wife, I think almost at 10, came in with her husband, and then after attending to the woman, the husband started complaining that the wife has problem with libido, that is, doesn't feel like always having fun with him. And he has tried everything possible, even bought drugs, even started adult movies, opened adult movies, gone to adult sites, gone for counseling. Still the woman is a bit too rigid with her body. So I asked him, has this thing been happening even before this pregnancy? He said yes, that they've been married for like 3 years and this is what he's been experiencing. So I then told him, okay, don't worry, after this pregnancy, let us talk about it well, because right now I can't be able to do much, because most women in their pregnancy also have that kind of reduced libido. So he listened to me. Then last week Monday, I was on call, and I had 5 successful deliveries. And one of those women delivered was this particular woman that the husband was complaining is a bit too rigid with her body. So she had during the delivery, she had the perineum was a bit tight, too tight, and the vulva was too tight. The head of the baby was very much bigger than the vulva, so it necessitated that I had to give her episiotomy, and the episiotomy was a bit too generous because I had to give bilaterally here and here, so that the head of the baby can be able to come out. So after giving the episiotomy, I repaired it, and after repairing, I gave them the normal home care advices. Don't sit, you have to sit bath with warm water and salt. Don't sit in hot water. Don't sit in hot water, and then sit on a plain. Don't sit on the bed, but sit on. Whenever you sit down on a plain wooden stool, so that it will help to gum the surfaces together. And then, of course, don't traumatize the area for any reason. They went home. Now that was last week Monday. So this particular yesterday, that's Monday yesterday, I was now on duty, and this lady came in. She was more like she was fuming. She was angry. The husband was shouting. She herself was murmuring. So the nurse called me. I went to her. I was like, what is really the problem? She told me that I don't know my job. I did a very poor job. That after all these things I did, she suffered. That tear I gave her, that I repaired, the thing gave way. The thing has given way, and she's bleeding, and she can't even walk where it's painful. I said, you mean that repair gave way? He said like one. He said no, the 2. That was the way she was reporting. And I said, okay, I appeal to the lady, don't worry. Your baby is alive, you are alive. All these other ones are things that can be handled. Don't worry, let me take you in and see it. If he has given way, maybe I use the smaller stitch, because I normally use small stitch like Wike 2.0, so that it will not leave scar. But maybe this time around I have to now go up to Wike 2.0, Wike 2, so that it will be strong. It will be stronger. That's what I told her. And I told her, please come in. So I took her into the laboratory and I told her to undress. She undressed. I looked at the vulva. I said, how can this episiotomy loosen from the tip to the edge? That is from the very edge to the tip to the outermost surface of the vulva, and then this one also loosens from the. What kind of small repair did I now do that led to this? And I called the man. I told the man, please come. What led to this? The man said, it's not my fault. Hey, it's not my fault. That after repairing all these things, The place now became too tight. On Tuesday morning, they left on Tuesday morning. On Tuesday evening, that he wanted to make out with her, the place was too tight. Then he had to use his hand, and tear it now, and tie it so I can be able to do his thing. I said, you tore it. That is, you used your own hand and tore it. I said, what was the woman doing that time? He said, well, the normal thing now. She always shouts when we were about making her. So, as usual, she was shouting now. The nurse I was working with shouted. I said, doctor, this one is a police case. So, this is murder. This is murder. I told her, no, it is not yet murder. It is not yet murder. I told the man, and your wife came in here and started with insulting me that I did a very poor repair. The woman said, yes, now, if I did a very good repair, the place wouldn't be too tight. And even if it's too tight and I did a very good repair, the man would not have been able to tear it now. That's all because I didn't do a good repair. I said, really? I said, okay, no problem. Let me now do a better repair. The man said, whatever you are doing, make sure there is enough space. So I said, no problem, there's going to be enough space. I now repaired it. After repairing, I called the girl's mother. I told the girl's mother to please come here. I insisted that because they are living with the parents, the girl's parents is living within this area, while she and the husband is living like about 3 or 4 kilometers away. I now insisted that the mother of the lady must take that lady and her child home. Let them stay with her at least for just 1 month before going to the husband. That is what we've been settling all
Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Tretaton, the Lupus Day, the Lupus Day, the Lupus